Bipolar and related disorders. Bipolar disorder, formerly called manic-depressive illness or manic depression, is a mental illness that causes unusual shifts in a person's mood, energy, activity levels, and concentration. These shifts can make it difficult to carry out day-to-day tasks. There are 3 types of bipolar disorder: bipolar 1, bipolar 2, and cyclothymic disorder. All 3 types involve clear changes in mood, energy, and activity levels. These moods range from periods of extremely up, elated, irritable, or energized behavior known as manic episodes to very down, sad, indifferent, or hopeless periods known as depressive episodes. Less severe manic periods are known as hypomanic episodes. Clinical features of manic episode: more than 1 week of elevated or irritable mood and increased energy activity. More than 3 of the following symptoms. 4 if mood is irritable only. DIGFAST mnemonic. Distractibility. Impulsivity, indiscretion, risky behavior. Grandiosity. Flight of ideas, racing thoughts. Increased activity, psychomotor agitation. Decreased need for sleep. Talkativeness, pressured speech. For the manic episode. Symptoms of manic episodes are more severe. Symptoms last for 1 week unless hospitalized. Marked impairment in social or occupational functioning or hospitalization necessary. May have psychotic features, hallucinations, delusions, makes episode manic by definition. For the hypomanic episode. Symptoms of hypomanic episode are less severe. Symptoms last more than 4 consecutive days. Unequivocal, observable change in functioning from baseline. Symptoms not severe enough to cause marked impairment or necessitate hospitalization, with no psychotic features. Bipolar 1 disorder. Manic episode. Depressive episodes common but not required for diagnosis. Bipolar 2 disorder. Hypomanic episode. More than 1 major depressive episodes. Cyclothymic disorder. More than 2 years of fluctuating, mild hypomanic and depressive symptoms that do not meet criteria for hypomanic or major depressive episodes. Diagnosis of bipolar 1 disorder requires more than 1 manic episodes. Although most bipolar patients will experience both major depressive and manic episodes in their lifetime. Manic episodes can occur with or without psychotic features, for example, delusions, hallucinations. Bipolar 1 disorder is diagnosed in patients who experience manic episodes, severe symptoms causing marked impairment, possible psychotic features. Major depressive episodes are common but not required for diagnosis. Pharmacotherapy for acute mania includes mood stabilizers such as lithium and valproate, and second-generation antipsychotics, for example, risperidone. Patient with current major depressive episode, more than 2 weeks of depressed mood, low energy, hypersomnia, increased appetite, decreased concentration, loss of interest, and history suggestive of a hypomanic episode, increased activity, energy, and confidence. Decreased need for sleep are consistent with a diagnosis of bipolar 2 disorder. Hypomania is differentiated from mania by a lesser degree of severity and functional impairment and the absence of psychosis. Patients experiencing hypomania exhibit a noticeable change in behavior, but are often very productive despite requiring less sleep. In contrast to manic patients, those who are hypomanic are often able to work and are rarely hospitalized. Patients diagnosed with cyclothymic disorder experience at least 2 years of numerous periods of hypomanic and depressive symptoms that do not meet the criteria for hypomanic or major depressive episodes. Flat affect, that is, reduced emotional expressiveness, decreased attention to personal hygiene, and thought blocking, that is, sudden inability to finish a thought, are findings typical of schizophrenia. In contrast, patients with bipolar disorder exhibit intense and labile affect, increased thought productivity, and pressured speech. Low self-esteem, psychomotor slowing, that is, slow speech and movements, and social withdrawal are more typical of a major depressive episode. Patients in a manic episode are typically grandiose or overconfident, physically restless and hyperactive, and expansive, for example, overly friendly and eager to talk to strangers. Patients who experience major depressive and hypomanic episodes are diagnosed with bipolar 2 disorder. In contrast to manic episodes, hypomanic episodes are less severe, do not involve psychosis, and cause a lesser degree of functional impairment.